Thanks to the advancements in medical technology, consumers can now rely on Reway's simple and effective live cell therapy per tier placenta to live longer and gain better health.
There is a great difference really between injections and oral administration. That is why it was difficult for me before. It was difficult for me to accept it right away. I had to examine myself and I had to try it for myself to see if it was really effective. And because they went to our clinic and underwent stem cell therapy injections. But of course we charge 1 million to 1.5 million pesos. So it was very expensive. Only the rich and the famous, shall we say so. Only the rich and the famous could afford receiving stem cell injections. And they explained to me the product. I was difficult to be convinced, you see. But because they said it was stem cell, I got a little bit interested because I am also involved in stem cell medicine. In fact, I am the president of the Philippine Society of Stem Cell and Integrative Medicine. But the stem cells that we use are not oral, not taken by mouth. It is given by injection. Because I am a doctor and a surgeon, we do surgery, we get bone marrow stem cells from the bones, being an orthopedic surgeon. If we do not get stem cells from the bone, we get it from the belly, from your abdomen. We get the fat, and then we process the fat, remove the stem cells, the mesenchymal stem cells, and then do some centrifuge and re-inject it to the body. So because of my experience with stem cells, we call this autologous stem cells coming from the patient's own body, I was a little bit skeptical on stem cells being delivered by mouth or given orally. After the talk, they gave me 7 bottles and told me, "Doctor, you try this 7 bottles. Just try it." And okay, I received the bottle. They said it was free, so I received it. Now, I had the opportunity to train in stem cell medicine in Florida several years ago. I was in Florida and I was in Dr. Joseph Porita's clinic. Dr. Joseph Porita is professor of orthopedic surgery at the University of Florida, USA. And his subspecialty is orthopedic stem cells. And he invited me to observe and to train with him in his clinic. So I was there for 6 months, and I observed that there were a lot of patients who were lining. They were queuing up. They were outside the clinic. They were very heavy people. They were probably about 300 to 400 pounds. And they were all senior citizens, probably 60 years old to 90 years old. And they were wheelchair bound. They could not walk. And these patients came from different places of the world. And they just went to Florida to visit my mentor, my teacher, Dr. Porita. And Dr. Porita puts the patient to sleep by giving anesthesia and then gets bone marrow stem cells through a surgical procedure. And sometimes he also gets stem cells, fat cells from the belly. And after this, he processed the cells, removed the stem cells, with centrifuge, put it in a test tube, and then inject it into the knees of this patient. These patients have already been scheduled by their doctors to undergo total knee replacement, meaning to say that their knees are to be replaced with an artificial knee. So these patients go to Dr. Dr. Porita because they do not want to undergo surgery, and total knee replacement. So they instead have themselves injected with stem cells. And after 4 sessions, at 4 to 6 weeks interval, 4 sessions, which cost about 15,000 to 20,000 US dollars per session. And after 4 sessions, the patients can walk now. So I was really amazed. It was really a miracle. It is miraculous. Their patients, instead of undergoing total knee replacement, do not anymore undergo total knee replacement, but undergo stem cell treatment with Dr. Porita. So Dr. Porita has done a lot of research, and I am personally a witness to the effectiveness of stem cells in osteoarthritis. So that is my experience, that seeing a lot of patients being treated and cured by stem cells instead of undergoing total knee replacement, they are cured because of stem cell injection. So my mental impression is really that stem cells should be given through injection, because that was my training. Personally, I found that it was really effective. Although I did not use the stem cells for osteoarthritis because I have no osteoarthritis yet. But I also found out that in my patients that I had recommended stem cells, oral portio placenta, they improved. They're walking, instead of having a waddling gait, they're walking improved. They are not using a cane anymore. They are walking now with a good gait, you see.
Research has also shown that deer placentas are most similar to human placentas, be it chemical or physical effects. It is also proven to cause no known allergic reactions. Deer placenta is the main reason why Pertia chooses to use it as its main ingredient. Deer placenta is obtained through natural delivery by the doe and does not involve killing of deers in the process. To ensure that no chemical substances are found, Reway carefully guards every stage in the production process, thus gaining known recognition of the safety and effectiveness of Pertia placenta. In order to provide a more comprehensive and complete formula, Reway has been actively involved in achieving excellence in its innovative research and development.